This meeting is being recorded. Very good. All right. We have 15 people who are signed up to be in this working group, and there may be others who may be interested in the future. And there may be some who may choose to gravitate towards one of the other work groups, which is fine too. This is pretty much an open meeting, and the rules are pretty well relaxed here as the participation, because we are a work group. So I want to welcome everybody to the Vital Communities Child Care Facilities and Program Models Working Group. This is, of course, the first meeting, and I am partnering with Jen Parker. She is the co-facilitator of this working group, and hopefully together we will be able to accomplish our goals and objectives, and we'll talk about those shortly. So what I want to do is I want to start out with introductions, and one of the things that I am pretty insistent upon is that we run this meeting efficiently. So timing is important, and we stay focused on the objectives we have to accomplish. So every person has 30 seconds to be able to tell us who they are and who they're affiliated with and why they're here. So 30 seconds, I will start. My name is Sean Mulholland, the city manager from the city of Lebanon. And the reason why I'm here is two reasons. I am an employer, obviously, of 187 full-time employees, another 90 part-time. And a lot of those have childcare needs. And I'm also I have a responsibility to the entire community. And I've been asked to help facilitate this particular group. Move on to Jen Parker.
Hi, everyone. I'm Jen Parker. I am the owner of Creative Kids Adventures Childcare Program in Grand Thumb, as well as running the after-school programs for the Hartford School District in Vermont. And I am here to support the early childhood community and fields, because we know that there's definitely a lack of spaces available. In part, a large of that is associated with the lack of staff available. So I'm here to support this group and figure out ways that we can help our community in facilities management and other outreach opportunities. And I look forward to the conversations.
Moving on to Julie McConnell.
Good afternoon. I'm Julie McConnell, working part-time now with the New Hampshire Community Loan Fund in semi-retirement, but I've been involved in the early care and education field for over 30 years. And in my role with the Community Loan Fund, we have a particular focus on financing and technical assistance. So we do provide financing for childcare facility needs, working with both for-profit, proprietary programs as well as nonprofits. And we developed our Business of Childcare initiative, providing targeted business technical assistance to programs. And happy to be here. Thanks.
Thank you, Julie. Moving on to Liz Burdett.
Hello, I'm Liz Burdett. I'm the Assistant Director at the Hanover Parks and Rec Department. Our childcare programs represent a large portion of what we do here. We run an after-school program with approximately 120 kids a day. And then in the summer, we run programs with about 250 kids a week. And given those numbers, we still can't meet the need of the community. So I'm here to see what we can do to help improve that. And my mom has worked in childcare for years. And so I've seen the struggles and, the inequity in pay and all those things. So those are the reasons I'm here.
Thank you, Liz. Katie Roach.
Hi, I'm Katie Roach. I'm the interim principal and preschool coordinator at Mount Lebanon School in Lebanon. I'm here because Dr. Roberts asked me if I'd be interested in sitting on this committee. I've also I've been working as an early childhood coordinator in Hanover for a while, and now in Lebanon for 7 years. And there's a definite, since I've been here for a long time, around need for more childcare opportunities. And our early childhood program in Lebanon within the district is one of the few childcare areas in the city of Lebanon. And we need more places for more kids, because I can only service 58 kids, which isn't enough.
Thank you, Katie. Kim Ebb.
Good afternoon, everyone. My name is Kim Ip, and I'm a Community Engagement Coordinator at New Futures. We are an advocacy-based organization, and one of the things we do advocacy around is childcare. So I'm this group today.
Thank you, Kim. Jesse Rete.
Yes, hi, I'm Jessie Rady. I'm a program officer with the Couch Family Foundation, which is an Upper Valley focused foundation, also with a program focus on early childhood. And for the past 6 years or so, I've been deeply involved in early childhood education work, supporting providers in the Upper Valley, and also figuring out ways to improve systems around childcare. So glad to be here. Thank you.
Thank you, Jesse. And Faye Grierson?
Faye Grierson. I am the Employee Resource Navigator at Alice Peck Day, part of the Dartmouth-Hitchcock Health System. My job is to support employees and connect them with resources they need. It's very clear that childcare has had a large impact on employers in general, and with over 500 here, crosses communities, and has a real impact on shift workers, who often have to leave early or come in late because they can't cover those other sides of school time.
Okay, and from our steering committee, Amy Brooks.
Hello, I'm Amy Brooks. I am the Executive Director of the Early Care and Education Association, and we are a network of licensed childcare programs in the Upper Valley. And I'm excited to see all these people here. And
Andra from our steering committee.
I'm Andra Dunhauer. I'm an eco-psychologist who works with the Integrated Services team, and also working to just improve all the networks among providers for early care and education and other services for families with young kids in the area, in the Upper Valley area. And I'm, as Sean said, I'm a member of the steering committee for this initiative.
And Doreen, staff from Vital Communities.
That's right. I work at Vital Communities, and I assist Sarah with several tasks, and she asked me to be here for technical support and just to help keep track of things. So if you need anything, chat me.
And Sarah Jackson, our Executive Director from Vital Communities.
Hi, great to see everybody. I'm here because I care about all that we can do to help the Upper Valley thrive, and I am increasingly aware, after being in this role for 14 months now, how critical childcare is. So when we were asked by a number of groups to see if we could convene some symposia and work groups around this issue, I thought we should step in and help to work toward action and solutions, along with all the people who are here and already doing that. So, and Sean, I didn't know if you noticed that Rachel joined us. So Rachel, we're just doing quick introductions, name and why we're here.
So Rachel.
Hi, I'm Rachel Williams. I'm the Child Care Subsidy and Referral Program Supervisor at the Family Place in Norwich, Vermont. And previously I was a private school administrator for an early and primary ed center in South Carolina. So been working with early ed for a while.
Okay, and then I see Susan Dickin.
Hi, my name is Susan Dickin, she, her pronouns. I'm the Associate General Manager at Northern Stage, here to kind of learn how we can continue to support our staff members and our guest artists who are here short time that need childcare. So really excited to hear the discussion.
Well, welcome, Susan. We appreciate you participating today. Okay, so we have other members who are not present today, but we are going to move on. So item number 2 on our agenda is administrative items, logistical items, and I'll turn that over to Sarah to talk about those.
We're creating, right now we're working with Google Docs. We're having some discussions internally about how best to share things, whether Dropbox or Slack or other methods. I'm hearing pros and cons in each, so I have to confess we're still working with Google Docs. We will be sharing out the notes and the recording from this session. I think you'll be discussing at this meeting how frequently you want to meet and when, and Doreen will be following up as needed with doodle polls and then sending out calendar invites. Sean, what am I missing?
If you want to talk about the stipend issue, want to cover any of that piece?
Sure. We do have a budget for stipends. We've wanted very much to have early care and education providers be part of these, all of the work groups, as well as parents. So we're making stipends available. We're looking at a sort of 3-month sprint for this first part of the work group. So we're offering $250 for these 3 months. And so people who are not getting paid to participate through their employers who are needing childcare to participate in these meetings, and especially early care and education providers, we are keen to get those voices heard. So as you share about this work group and this initiative, I hope you'll reach out to your networks and encourage people to join and not let the cost of doing so be preventing them from participating. If you know of people who want to receive a stipend, they can email me, and eventually Andra, who is going to be joining our staff in a part-time capacity to help with this initiative. So I'll put my email in the chat for now because Andra doesn't have a Vital Communities email address yet, but she will. So so I'll put that in the chat. Any questions on that?
No, just want to applaud that commitment, Sarah. That's wonderful.
Mhm.
Well, and we hope to continue it after this first 3 months, but we also thought 3 months is probably a good time for people to be able to commit and see if they want to continue. So.
All right, we'll move on to item number 3, discuss review the working group charge, what our responsibilities are, what we, our goal is, what our objectives are. So our goal is to identify and catalyze strategies to reduce operational costs, including cooperative procurement of services, tax breaks, and etc. The tent that we have is a rather large tent, different types of programs. When we get to item number 4, you'll see some of the initial items that we had thought about, and I'm hoping that you will have others. And that's why you're here, to help us work through this. I am certainly not a professional in the childcare business at all. My profession's a different one. That's why I've got Jen Parker that's helped me to co-facilitate that. She's the brains of the operation here. But you folks are going to help us hopefully get through this and come up with some decent ideas to accomplish the goals. We are not operating in a vacuum. There are 2 other working groups, the advocacy working group, and their goal is to create an exchange of successful policies that advance the goal of the initiative in each state and engage Upper Valley businesses in bi-state advocacy on behalf of this issue. So we're going to have probably some overlap with them, and that's why we have the steering committee, which is going to help to make sure that we're all going, the ship is all going in the same direction. And then the staff and retention recruitment, the goal is to identify and catalyze short and long-term strategies to increase retention and recruitment of child care center staff. So that's what those folks will be working on. Some of you have signed up for multiple committees, so you may be working on those as well, which is absolutely fine. And then we'll if you've got that sort of time to commit, that's going to be helpful to us because we'll have that crossover, because I will not be directly involved in the other groups. So you'll be helpful to us if you're working with the others as well. The role of the Child Care Steering Committee is to make sure that the 3 working groups stay focused, and when there's overlap, where they can work together to keep this whole process moving forward. And then when we have the work products at the end, to make sure that we have actionable items that we can push out to all of the players that are involved. So that's kind of a broad brush. Does anybody else on staff want to add to any of what I just said, other than just a couple of things? There is a focus on infant care, which was identified earlier. That's become even more of a crisis than childcare in general. So that is a focus we're going to have. And also, when we look at things, we need to look at them through the BIPOC perspective. We need to make sure that the marginalized populations are not forgotten in this process. And when we look at these solutions, we look at them through that lens and everything that we do. That's new for a lot of organizations. It's new for my organization here in the city, but it's important that we model that and we do that as we work through this process. So comments on any of that? Again, anybody from staff that want to jump in and add to that? I know Amy's leading one of those groups. Anybody else?
One thing I'll just say is when we planned the symposium and then started working on these work group ideas, we very much want to draw on what is already happening in the Upper Valley and not duplicate it. So I'm particularly excited by all of you who are here who are working in these areas, and we want to figure out ways to draw on your expertise and your needs as you're seeing them, and what can we do to tackle them, but also draw on what you're already doing in the solution space and not duplicate it, but amplify it, complement it, and so on. So just want to emphasize that.
Anybody else? Andrew?
I just wanted to tag on to that, in addition to, anecdotal experience about what's already happened or what has worked in the past and maybe could work again with different conditions. The steering committee has spoken about how important it is for all three work groups to have kind of a research, so both research on like other, creative things that are tried and true and sort of have worked in other places or have worked, in the Upper Valley, but also kind of innovative approaches as well. So especially in looking at facilities models and economic models and things like that, we really want to have, kind of a basis of like, just data and information behind whatever we're doing, in addition to having experiential, anecdotal information.
Anybody else would like to comment on this item? Or have any questions about what we're trying to accomplish, our group, as well as the other groups that are working alongside us in parallel with us? I see none. Okay, moving on to number 4. Now, I sent out the agenda. I think everybody who was listed on the committee, I know that Susan, Rachel probably have not received this, and Faye, I just sent it to you because I didn't have you originally listed. The 90-day work plan template that we're going to work from, just to keep us on track and make sure we meet all the pieces of each item that we're going to be working on. The big goal is for the first 90 days, what can we accomplish right away? And if we look at the list in number 4, I'm thinking item number E is probably something that could be a short-term victory that we can accomplish and get something that's available that we can get out to employers that they can start to run with and get on our website with some resources on that. And that's what can employers do now? And I think it's important that we're in the middle of a crisis, that we do provide something within that first 90 days, hopefully before 90 days. And we'll use that 90-day work plan template, which I will build out. And that'll be our goal to get that moving. Anybody have any other thoughts in terms of the first 90 days to have something we can actually complete in that short period of time? And we'll talk about how frequently we're going to meet at item number 5 next. But that was my initial thought. Anybody else have any thoughts on that? I think everybody has the agenda other than maybe Rachel and Susan.
Sean, I was just wondering if we wanted to discuss some of these other options as well, and just maybe have a sub work group who might do some research on developing, or what it would take if we were to do, I'll just pick like a group health insurance pool, for example. I don't know everybody's backgrounds and abilities to have access to things like this, but shared resources is one of the things that we've been talking about as an early childhood group for a very long time, but we haven't been able to move on that. And I just wonder, with the expertise that we have in this group, if there's maybe room for subgroups to do some research within those 90 days. And I hear what you're saying as far as what can we do now, what can we put in place in the first 90 days? And I think that's great, but could there be a little bit behind the scenes work too?
Yeah, so there's a number of things, because I think we're going to need probably some outside technical assistance to help out with some of these. For instance, I'm seeing some of these is probably going to require a certified public accountant to help us out on the tax side. And I'm also seeing an economist is going to have to help us out with one of those. So on that item number B, and also item number C, there's an entity called Cca Global Partners, created by Howard Brodsky, if you're familiar with him. He's an entrepreneur, and they're experts at creating cooperative organizations. And I haven't reached out to them yet because I wanted to talk to you first, and I don't know whether there's a charge for their services, but they can help us walk through that process of creating a cooperative or cooperatives And that's what they do on the private sector side and the nonprofit side. They're out of Manchester, and they're quite well known. So any thoughts on that? Julie?
Sean, I can just add to that. Cca Global has been very active in developing a national platform for early childhood programs. And so that's already available in New Hampshire through Early Learning New Hampshire. So they've started down that path of developing shared resources with the platform and through the State Early Learning Alliance at Early Learning New Hampshire, not so much forming a cooperative. And you're right, that's their expertise, but they're deeply committed to early childhood through the development of this platform with resources. So that would be, one good starting place to get some familiarity with what's already been developed along those lines.
Yeah, so and that's going to take a little bit longer. We're not going to get that up and running in the first 90 days. So that's going to have a number of milestones that will be required, and we'll have to build out that timeline. And I plan on doing some of that work again with it, starting with the 90-day work plan. What pieces of that can we get into place in the first 90 days? And what are the outcomes of those things in the first 90 days and moving in that direction? So I guess we'll just go through, we'll start with A, property tax exemption for childcare facilities. This was something that was initially talked about, the value of that. Obviously, if you're a private sector entity, that has a major impact on your overhead if you're running a business for that. And if you're a nonprofit too, some of those will qualify for a property tax exemption, and some of them will not, because they have to be considered a charitable organization. So that's something that would require the advocacy group to get involved in as well, because that would be legislation that would have to go into the next session of the legislature in the state of New Hampshire. I don't know about the Vermont side of how they operate. I'm not as familiar with that, what their timelines are. I'm very familiar with New Hampshire, but we need to look at that on both sides. And I presume there is no property tax exemption in the state of Vermont for childcare facilities, other than probably the charitable organizations, unless somebody knows to the contrary.
Is there an abatement route that could be taken more locally so it didn't take so much time?
Well, right now, municipalities, at least in the state of New Hampshire, there's no legal authority to do that. We can only provide abatements or exemptions for that which the law allows us to do. And unless you qualify as a charitable organization, and a lot of them will not, there's no carved out exemption in RSA 7227, but there could be, because there's a whole list of them that are in there now, and that could be one that gets added. But that can't happen until the next legislative session, which is next fall. But we'd have to get prepared for that and draw up the legislation and get advocates involved with that. And again, on the Vermont side, we'd have to look at that as well, because we want to make sure we deal with both sides. Half of my employees live in the state of Vermont, so I have just as much of an interest there as I do here. So does that make sense to folks? Any other thoughts on A? And I can map that out, what that process looks like. And again, we're going to have to talk to our partners on the advocacy group, because that starts to get into their lane of travel over there.
Amy or Jen, do you have a sense of, Katie, you're also, but you're with a city center, is that correct? I was just wondering if people have a sense of how much of a burden is that for centers. Should we prioritize this?
Like the tax piece, I don't know about the tax. I don't know anything about the tax piece. I'm part of a city.
I brought that to the group because I know of a center in Lebanon that is a nonprofit, uses the entire building, serves a great deal of children on scholarship, and rents the entire space from a for-profit, so pays property tax through rent. So that's why I brought that up, because they're operating on a shoestring and they're paying taxes, and they're technically a nonprofit. So for those circumstances, and for profits, I mean, my thought was, like, you want to expand family childcare, high quality family childcare, offer an abatement on your taxes if you're a 3-star or above family childcare, serving 6 children or something. That might help people consider offering that as part of their home and part of their home. So that's where kind of I thought that would make it, it's a strong piece, I think, to pursue.
And not only that, I think the impact of that is not going to be significant to city coffers or town coffers at least in the state of New Hampshire. And my understanding is in the state of Vermont, the property tax is a much smaller piece of their revenue stream as it is anyway. Whereas in New Hampshire, it's very heavy. So again, any other thoughts? Anybody object to that? I think that's a bad idea. That's something that we could pursue. And I can help map that out and work with the advocacy committee, because that really is in their lane more than it is ours.
I would just add that certainly for-profit providers, it would have definite impact, and even the nonprofits in New Hampshire, we're seeing increasing pressure for even the nonprofits to make payments in lieu of taxes, even when they're not required to. So to elevate that issue more broadly for both for-profits and nonprofits could be beneficial.
Yeah, that's why I included, I think it was important for both of them to be able to do that.
Mhm.
The for-profit entities, we need to keep everybody, every sector involved in this, whether they're for-profit or nonprofit. I mean, we don't even have enough with the two the mixture that we have right now, never mind losing any of them, which we are. But the timeline on it is longer, at least in the state of New Hampshire. It wouldn't be till next fall before I get legislation in, which means that you wouldn't see a bill if it makes it through the process, which is always difficult, until the summer of 2023. And those have to be applied for by April and March of any given year. So you wouldn't see the impact until 2024 on property taxes. So there's a long timeline to make that work, at least in the state of New Hampshire. And again, I'm not familiar with the legislative process in Vermont, which we're going to need to do. And hopefully somebody in the advocacy committee is more familiar with that process and help us work through that. So unless there's any objection, I'm going to start to build out the timeline and the process for that, especially the first 90 days, what we'll need to do with that, and then move that on from there. And we've got legal counsel here that can help draft up legislation in the city, so there's no additional charge to do that. If no other discussion on A, I want to move to B, creation of a service support cooperative for child care entities. And Jen, do you want to talk a little bit about this and about some of the value of this might be for child care centers?
Yeah, sure. So we know that in general, childcare providers are not paid, a very high living wage, and a lot of that is because we are dependent on income that we get from our families, and so we cannot bill out and charge what it costs to pay an adequate wage. Therefore, we're unable to provide a lot of benefits that other financial institutions and businesses are able to offer, such as health insurance, liability insurance, the things that you see listed there. We do have to do the workers' comp because, we're required to do so as a business, but pretty much all of what we're talking about in this group is how do we improve the budget of childcare providers and businesses so that we can sustain our field and hire and pay an adequate living wage to the employees that we're trying to attract. And I think that that's our biggest barrier, because we lose a lot of people to the school districts who offer these benefits and wages, and therefore we're not being able to attract those people. So I think, whether we're talking for-profit or nonprofit, let's be honest, there's not really a profit, however you set up your childcare business. So really just trying to figure out how can we pool together as an organization of early childhood providers and be able to buy into a network or pool of insurance as one big entity. Let's say early care and education, was our hub, and then we just had these umbrellas underneath that organization and that we could all pool from, so that we're saving on individual program costs and being able to offer these benefits to employees that we're trying to attract. So I think that's kind of the mindset, that I'm coming from and that I'm trying to represent from our field, and then reaching out to businesses and trying to figure this out, because we've been talking about it for a really long time, and there's things are starting to happen, like through Cca and whatnot in New Hampshire, but we really need somebody who can get us going, but then also lead each program down the path of how to buy into it as well. So there becomes that component.
So that's where I think a Cca Global Partners could help us build that structure. Municipalities do this now. All of our health insurance is pooled. We have a health insurance pool in our state. We also have a liability insurance pool, and our costs are significantly less than paying what we pay on the general market to do that. And those pools exist solely for the purpose of serving municipalities. We buy salt, road salt. We do that as a pool. We get a fixed price set that's much cheaper than the private sector is to buy salt at a shopping center to put salt on their parking lot. We pay much less than they do. Same thing with fuel and a whole number of other items. And it helps on the margins. Again, it's not going to, it may not make substantial changes in the operating cost of an organization, but it can reduce cost. And again, it's one of those things that helps in the margins. And I think it's worth taking a look at. Anybody else have any thoughts on a cooperative a support cooperative for childcare facilities or providers, I should say?
I think probably now's a good time to talk about what Cca has to offer and what their limitations are. And also, Julie, I don't know if you remember when we tried to do this pool for health insurance, it had to go through a piece of legislation and we didn't get it. It was a while back, Jen.
Yeah, there were legal limitations to doing it. I don't know what the current restrictions would be, but at the time that this was looked at previously, because I do a lot of work on the advocacy side as well, there were legal hurdles to doing it, but I think it's worth revisiting. And I think certainly it's a different issue now too, with access to the Affordable Care Act and those provisions. It's a different question.
So ECEA and Work United, I don't know if you were all familiar with Work United, but it is a program where a United Way has a resource coordinator that we have 4 main hubs for childcare centers, and all centers are eligible to receive services. And we are just adding, this would be services of support, anything outside of HR. So if you're having an issue with your employer, that would not be something that Work United works through, but it would be something, if you're struggling to find dependent care support for an elderly parent or something, that we are just beginning to add support for navigating and getting onto the marketplace to that. So anybody who is uninsured or underinsured will be able to have the support of a Work United representative who will also be qualified to sign them up on the marketplace. So that is starting immediately. They're in the process of training. Julie, do you feel comfortable describing Cca? Because I'm not.
Yes, generally I could. And at some point you may want to have staff from Early Learning New Hampshire share their current thinking and planning. But Cca is the State Early Learning Alliance, a program of Early Learning New Hampshire that really was created to pursue the kinds of strategies that you're talking about for the Upper Valley. They started with a pilot program on the Seacoast, and they're now actively fundraising to expand some of their offerings. So it includes primarily access to the platform, the shared resources platform that I referenced that has been developed by Cca Global. One of the barriers to that has been that Cca has not been able to always offer that for free. My understanding is that in Vermont, programs have free access to that platform. So that's kind of one minimal thing that could be considered. How do we ensure access to that online platform is available for free to providers? And then Cca also includes a property management partnership and function where they are providing pooled purchasing power for insurance, for food, for curriculum classroom supplies, so a wide variety of savings. And I know that CELA represents that programs can save anywhere from, 5 to hundreds of thousands of dollars a year through participation with CELA. And there is a membership cost to that. But I think there are certainly components of that that could be looked at that are on our agenda. As well as CELA can talk about the barriers to some of the things like pooling health insurance.
My question would be, would CELA come to this region and customize those pooled services? So it wouldn't be they have to go to Concord to get it or something like that. And then the other thing, like flat out, it's $2,400 a year per center. So for a small center to gain $2,400 back. Another barrier is being part of the pilot was finding the time as a director to do all that research and get all of that without a administrative department and without an HR department and without a business department to do that for me. I never went on the website. I just did not have the time.
Yeah. And I think CELA certainly recognizes that, because part of their current strategy includes having navigators for that very reason, to take that burden off of program directors. But again, I think that's just another piece of this conversation that's worth having. And I don't know about the ability to customize. Again, I think those are all worthwhile conversations to pursue.
And the other part of it is obviously you need to have enough mass to be able to do this, enough entities and enough persons involved to make it. We have, in our health trust, New Hampshire Health Trust has 70,000 employees and involved in it. So that's a big pool, and you can share those losses over a much larger group.
Right.
This group is going to be much smaller than that, and the liabilities are going to be much higher, and the risks are going to be higher. So that's why we should think about something like the Lawson Group has. They have a variety. They have loggers in there, forestry folks, and they have different groups, and they pool that together, and that's how they're able to do it effectively. So we may have to look at a different model than just childcare facilities, partner with others that do that, because they are successful in doing that. And again, it saves money on the margins. So I'll start to build that out, but I didn't know about the CELA group, which I need to investigate that some more. And I'm going to need someone else to help run with that. And again, I think there's other partners we can get the expert assistance with that.
Sean, I'd be happy to reach out to you, see if I can find a representative from CELA to attend our next meeting and hear from them, and get, maybe they'll even attend our group.
That would be, I think, a good thing. So you and I can coordinate that afterwards. That would be excellent. So I'm going to move on to item number C, creation of a buyer's co-op to purchase childcare services from providers. I was hoping that we would have the corporate council as part of the steering committee, and I was hoping we'd have some business leaders that would help to join us. I know some of you are, because you run facilities, so you are business leaders. But some of the other companies that are not in the childcare sector to help to get involved with this, DH and DHMC, Dartmouth College and DHMC are heavily involved in our steering committee already. And they are, of course, major employers. But the thought process that I had with this is that employers would combine together to be a buyer's co-op. So what we would do is something along the lines, and I can develop this model some more, but if we use the model, I think Vermont uses 12%. So 12% of a person's income is all that they should be paying for childcare. Nationwide, I think the number is 7%. I've heard that recently. So let's say that the city of Lebanon says to one of its employees, look, if you have childcare needs, we will have an allowance where you pay 12% of your income, no more than 12% of your combined income, for the cost of childcare. You'll fill out a form and provide that to us, and we would pay the other portion of that. We would subsidize the other portion of that so that you could have high quality childcare, and you would be able to take that voucher, shall we say, to whatever facility that you need. A lot of few of my employees actually live in a city because it's too expensive to live here. They live in Claremont, they live in Newport, they live over in Vermont. So they need to have a childcare facility that's close by where maybe their spouse is located. It makes less sense to have a facility right here because it limits those options and that flexibility. But let's say that we provided that, and then the city would pay that provider directly the difference. Now, in return, there would be some requirements. That facility, I shouldn't say facility, I should say provider, because it doesn't have to be a facility, it doesn't have to be a licensed provider either, but you have to meet some basic requirements of early childhood education and some basic, whatever those requirements are. You folks know about more about that than I do. Again, that's not my field. But if that's the case, and we have a number of employees, we can get sufficient mass to do that, we can help up, prop up the existing employers, and we'd be paying more than what the market rate is right now, because obviously the market rate is not enough to be able to meet the needs. But in return for paying that higher market rate, we would get better quality service, and that would help to prop up some of these, well, the childcare providers that are out there right now. That was kind of the thought process. There's a lot of complications and issues that would get involved with that. Looking at it from the lens of how does that affect employees on the scale? So I've got employee, if I'm dealing with 12% of their combined income, my upper end employees in the salary range, they're probably not going to qualify for that. But my younger employees, the ones that are coming in at the bottom, they're going to benefit more from that type of program. But again, that would only be good for employers that can afford to do that, larger employers. If you're at Dunkin' Donuts, you probably can't afford to balance out that additional 12% to make that work because of what you're paying and the margins that you operate on for your business. So there are pros and cons to that, but I was interested to see what you folks might think of that. And I can obviously draft this out in writing so you can take a better look at it. But just that broad brush, what do you think of that concept? Thank you, Katie. Brenda?
So the one thing that I heard you say, which I immediately jotted down because I wanted to make sure that to address it, I think it would be that there should be some standards set for what would be reimbursed. And I think the bottom line is regulated care. I heard you say that it wouldn't have to be regulated, and I would disagree with that. I think that you know, we're going for high quality here, and I think that regulation is one piece of that.
Yeah, my only concern is there may not be enough regulated facilities to be able to meet the needs right now. And there's a lot of folks that are providing that in-home type of care. Again, this is not my field, it is yours. You folks know better than I do about how.
Well, and I would also just take this opportunity to say there are legally exempt. So they're not technically following regulations, but they are legally exempt in offering the care, and that's perfectly acceptable, and that's recognized. And there are guidelines in both states about how to do that safely, successfully, in ways that we all feel good about. But I really do think that we wouldn't want to go outside of legally operating programs, be they registered family homes, licensed centers, or legally exempt.
Okay.
I would second that, just because we are really battling as a field and organization. We're losing a lot of our employees to nannying at home, to those that are operating out of their homes that probably are not legally exempt or following those guidelines. And this, as an organization and as a field, we've really strongly worked towards quality care and education, and that's our motto. And we want to be represented as professionals and recognized as professionals. And so I do think, if you know, I agree with this structure, and we've talked about it, you and I just think there has to be some guidelines, and I do think it has to be those that are following both states' licensed exempt protocols, so that they're on the radar of licensors who would follow up.
Rachel?
So I'm not sure how familiar you all are with the current child care subsidy program that Vermont has in place. It goes for, I mean, you can use it in really any state as long as they're approved, but it has some really good things in place as far as looking at who would qualify, the percentages we give. So I think if that was an avenue we'd look at, that there is already a model that we could look at building off of, and looking at, well, what are the faults in it that we could improve on, if we're looking at it as more of a localized option, especially with the state of New Hampshire, because it's very different on that side of the border.
So Rachel, could you provide us with a link of where that it spells out how that program, how that model actually works? Do you know where?
It's not the best website,
Brenda might
but
have-
I can send it out.
Sounds like Brenda might have it. She's going to provide.
Do you want to send it out, Brenda? And so right now it's called Bright Futures. However, by the summertime, it is supposed to be a different model. So if we're looking at it going forward, because they're going to change how everything is reimbursed, because it's just not the best. So they're working on improve it. So we could, I have information on how the new model is going to look, so we can look at what they have with the improvements.
And Amy?
Yeah, my notes were to, my thinking was that in order to qualify for that gap funding, that they first apply for childcare assistance, because if they're just entry-level people, they probably are going to receive something, and that would kind of increase your pool of money, because we'd be utilizing the pools of money already there by tax dollars. So being like first criteria is to apply to see if you can get any funding through New Hampshire, Vermont subsidy. And then my other question was to Julie, how close are we to true cost of care? Understanding that we have the market rate, which is when every 2 or 3 years, depending on which state you're in, they send it out to providers to find out how much they charge for each age group. And that's how they develop the market rate for the subsidy. The problem is that market rate is based on paying minimum wage. So it's
Right.
not the true cost of quality care. And I know that we were working on that in the state of New Hampshire, looking at the true cost market rate of if we paid our staff, a livable wage, what would that tuition be?
And you're right, Amy, we're not yet at full cost of care. Some states are really taking that on in a big way, trying to get to that point. We've made great improvements with increasing our rates in recent years, but we're certainly not to full cost of care yet. The other thing I just wanted to add to the conversation, looking at the different percentages, the feds have determined affordability at 7% of family income as a benchmark in terms of trying to improve federal policy. And I'm seeing 10% in Vermont. So there's a range there of, how to determine what's affordable for families, but no more than 7% is what the feds look at.
Yeah, so we've got to figure out what that number should be.
Mhm.
What is the cost per child? What should that weekly amount be? So we can figure that out. And then what are the requirements that we want to have to meet that if we're gonna subsidize that as an employer, for instance, because it's probably unlikely, at least in the state of New Hampshire right now, that our legislature is going to put funds up to subsidize this in a way that's going to be adequate under the present legislature. It's probably just not going to happen. The private sector is going, and employers are going to have to do something on their own to do that. That's why I'm thinking about our own program up in this area, not waiting for Concord to find a solution, because I don't think they're going to. So we can't wait for other folks. We can certainly dovetail and work with them, but there are things we have to take action on ourselves. And I've already taken action effective January 1 here in the city on what we're going to do, and we're going to keep moving that ball down the line. And I'm looking at the subsidy program for city employees as one way to get that accomplished, to provide that higher quality of care. But I really need to do that with a group of people like yourselves to make it really effective across the Upper Valley. So we've got what? Go ahead.
I was just going to quickly ask, is anybody aware of such a cooperative happening in other parts of the country? I'm just thinking, if there were ways we could not recreate the wheel if we pursue this. Any knowledge of that? I could ask Andra to do some research on it, but she had to leave early, but no.
Happy to reach out to, I'm a part of an association of owners that range from throughout the United States. I'm happy to reach out and see if anybody else in any other states is part of something like that, and see what I can find out.
That'd be great, Jen. Thanks.
Amy, I just want to ask Amy, have you and Brooke been talking? You had talked with someone who was sort of more of a national expert on shared services models, right?
I was just writing on the chat. Yes. Brooke, Christina, D'Alessandro, and even, the contact Jen from Cla, if I don't know how much longer Salissa's there, but she is actually going to Cca Global. So she would be able to tell you, here's kind of a version of that you could look at. And I know that the ECEA, we've been looking at trying to pull some of that back office piece off of directors, which would possibly include researching these pools of support, checking your insurance prices every 2 years. Directors don't have time to do that. Boards are not, up to it, especially now. We have so many nonprofits. We don't have a lot of strong board members to go do that. So we were looking at a back office hub that could do that collectively for all of the members. But Jen, maybe starting with the Cla person, asking them, and then if you don't get enough, then you could let me know and we can go through Brooke and Christina.
And Cla, yeah, as Amy indicates, Cla is part of the national efforts around shared services, and Louise Stoney, through Opportunities Exchange, has been a leader in this regard and has, helped advise New Hampshire. I know there are family cooperative networks, but it's Louise and Cla folks who might know of other cooperative models. But certainly the shared services strategy, there are many different approaches in different states that can be looked at as different models.
So Brenda, I think that would be helpful if you could do that. I just saw that item in the chat there. We have 5 minutes left, and I like to begin and end on time, and the trains run on time in my world. Item number 5, I want to jump to that real quick. In terms of meeting schedules and times, not everybody is here. I think the best way to do this will be to send out a doodle poll, and I'll work with Doreen to do that, to schedule the meetings. The question becomes, how often do we want to meet? Can we meet twice a month? Can we meet an hour and a half each time to do that? There is a lot on our plate. We are in the middle of a crisis, but the question is, can we do that? A lot of work is going to have to happen outside of the meeting for those who can do that. And we're not pushing anybody to do anything. You do what you can, right? And some people have already volunteered to do several pieces of this. So the question is that manageable? An hour and a half, 2 times a month? Is that reasonable to ask for folks? And then again, we'll send out a doodle poll as to find out when that is the best times in which to do that, dates and times. Let me ask, does anybody think that's not reasonable or would have difficulty with that? Got it, Rachel. Nobody, okay, so that sounds okay. And then we'll find out what the dates and times are. We can make that work.
I guess I would just sort of chime in one thing, that if it turns out that there's a lot of like external work that we end up doing in smaller groups, maybe keeping the big meetings to an hour each, and then so that we have, use that other time for the smaller group work, that could be another way. But for the next meeting, we clearly ran out of time today, so maybe an hour and a half makes sense.
And no, we don't even have all the members of our committee. There's quite a few that are actually absent, which will make it even more challenging to manage a meeting. So we'll try to go but I like, Jesse, I like our meetings. They seem to be the most efficient. For right now, we'll do the hour and a half, and we'll schedule a couple of those. And I think we're going to be breaking off into smaller groups to get some of these functions done, and then come back and report back to the main group. And then, of course, I have to report back to the steering committee, myself, Jen, and my other partners on the steering committee. So that's number 5, and we have 2 minutes left. We're not going to get through these other items now. I'm very interested in item number H, other ideas and members of the working group, because you are the folks who work in the field, and I've learned a lot today just by being with you about some of the things that are going on. So I think the best way to do that, if you could email the work group that I sent out the materials on, and I'll be adding other people like Rachel to that, and Susan, if you choose to be added to that, I can add you as well. And that way we can share the information. So when we come up with the next agenda, we'll have some of that that done. And I will start to work on the 90-day work plans for at least for the items we talked about, and start to flesh out some of the others. And that'll give you some context of what those are all about. And we can go from there. And in terms of expert assistance, the CPA we're going to need for the tax issues. So I'm going to work on getting one of those, and I may have to fund that myself. We don't have a whole lot of money in the budget for Vital Communities, and also an economist to help deal with some of those pieces. I'm going to get that spun up as well, and I will reach out to Cca Global Partners. We seem to be in agreement to see what they can do to help us out there. And some of you have some of the other tasks already assigned. Any other questions before we adjourn this august committee?
Thank you, Sean. We will make the recording and notes available. And
Very good, folks.
Doreen will send a doodle poll after consulting with Sean.
And Jen.
Yeah.
Very much. We really appreciate your volunteering, folks. I'm very excited about the direction we're going to go in. We've got the right people in the room, I think, to work through some of these problems. And I'm optimistic we will make progress from a very daunting challenge that we have in front of us. And you know that better than I do, because you've been in the trenches. So thank you very much and have a good day.
Thanks,
Thank you.
everybody.